So measles is a respiratory virus. It causes a cough, it causes a cold, it causes a runny nose, and it causes a rash. And the rash is what gets everybody's attention. The viruses are sneaky though. The rash doesn't come out till about 4 or 5 days after you've been contagious. So you've been out spreading this stuff for days. No one would send their kid to school with a temperature of 104 and a total body rash. But they might have gone to school 2 days earlier when they just had a little bit of a runny nose and maybe a little bit fever, but they look fine, so they go to school. And it spreads. It is one of the most contagious diseases on the planet. If you are exposed to measles droplets, so someone coughs on something, and you touch it an hour later, and you haven't had measles, 90% chance that you're going to get measles. So that's why it's important when you go through airports when people haven't been immunized. Somebody coughs on their hands, they go to the bathroom, they wipe the door, you haven't had that, your child gets it, your child has cancer. All these things can lead to bad problems. So it's a very, very, very contagious disease. Last year, over 100,000 people around the world died from measles. So it is a very, very big deal. It is not a huge cause of death in the United States, but worldwide it is still a major, major problem. And when a disease sort of disappears, people forget about it. But measles didn't forget about it, and it can still kill you. Like all these diseases, it tends to attack people with other problems, the very young, people with other diseases, people with pulmonary diseases, and older people. So if a child less than a year old gets measles, it can be fatal. If a 4-year-old gets measles who's well nourished, it's probably just going to cause a fairly benign illness like it did for my grandparents and my sisters. They got measles, they were sick for a few days, and they got over it. The lifelong immunity follows that. So in the mid-60s, the measles vaccine came out, and it did a very, very good job of eliminating most cases of measles and almost all cases of measles deaths in the United States. Vaccinations are the key to this. If we don't think that, all we have to do is look what happened before. We can look at the number of cases in the United States, 400,000, 500,000, 600,000 cases every year of measles, and then the vaccine comes in and it disappears. Now we have a handful of cases each year. And just because the disease doesn't kill you doesn't mean you want to get it. If you're a parent and your child is out of school for a week and you can't go to work, and then the next child gets it, and the next child gets it, next thing you know, your family's been sick for a month. And people feel bad. We do these things because we make you feel better. And there are, make no mistake, there are some serious life-threatening complications that occur from measles. It is almost unheard of for someone who's had both sets of measles immunizations. You get the first set at 12 months, the second one at between 4 to 6 years. It is almost unheard of for someone to get measles if they've had both sets. Every now and then it happens, but it's so preventable.